There are several different types of currents related to medical devices, and we want to go over 3 of those today. The first type of medical device current we want to talk about is fault. Fault current occurs when there is abnormal flow of power to the medical device, and in this case what we mean is a short circuit or some sort of break in order that power would not flow through the device as it's supposed to, therefore the name fault current when we think about the medical device. A second, we want to talk about risk current. Now, this would be normal flow of current through the medical device, and risk current comes in at least a couple of different forms. There is general. General risk current occurs when a device is working normally and not connected to any other devices, and it is not grounded. No ground, not connected to other devices, but working normally. This would be considered general risk current. And then secondly, under risk current, we want to talk about apparatus interconnection risk current. Under apparatus interconnection risk current, what we're talking about, it's a long name to basically say that this particular device is connected to another device, and the flow of supply of current is normal. So normal current flow, general, not grounded, not connected to any other device. Apparatus interconnection is connected to another device, and yet the flow of current is still normal. And then finally, the last type of currents we want to talk about are source currents. And under here we want to think about 2 things. One is chassis, and secondly, patient. Under chassis source currents, what we mean by that is that energy current flows through the chassis of the device and is grounded. Current flows through the chassis of the device and is grounded. Under patient conductor, the patient has the current flowing through them to the ground line. So the current flows through the chassis to the ground, the current flows through the patient to the ground. So this would be source currents. Risk currents, general, normally working, not connected to any other device. Apparatus interconnection, normally working current and is connected to other devices. And then fault currents, meaning there is a short circuit or a break and therefore current is not flowing. These are the things to keep in mind when we think about medical device currents. And